Hello, my name is James Smith. I'm an associate professor in electrical engineering and computer science at York University's Lassonde School of Engineering, and today I'll be talking about grassroots advocacy for improved air quality during a pandemic. Briefly, I'll start with an overview of science communication. I'll talk about me as a science consumer, and maybe you as a science consumer and a regurgitator of science. I'll talk about the specific topic of air quality and advocacy within that domain, and then I will give a few examples with respect to advocacy in COVID times. And from there, I'll conclude the talk. All right, why do we care about science communication? Well, the first one, from the perspective of people who work or engage at an institution like York University or any other post-secondary institution, is that science communication is good for our reputation, our institutional reputation. It's good for bringing students into our institution, for recruitment. It's good for hiring of staff and faculty, and it's good for bringing in grant money, whether it's directly or indirectly related to the science communication that we're doing. There are challenges, however, with science communication. First, quite frankly, a lot of what we want to talk about is boring. And we got to do something about that. Next up, competition. We are competing. When we're doing science communication, we're competing in the same space, social media, regular media, as a lot of other things that are going on in popular culture. We have issues of variable needs and framing of our topics. We have issues with innumeracy and knowledge deficits. We have issues with how people do mental shortcuts. We have issues with or challenges when it comes to people's beliefs and cognitive dissonance. There are, in spite of the challenges, good strategies for conducting good science communication. One is exposure, making sure that message is getting out time and again. There's the issue of timing, making sure that you strike when the iron is hot, that when something is right for your brand or topic of science communication, you get out there and you make sure that the duration of what you're talking about and how you're talking about it is right. There are lots of different platforms for doing science communication. There's the traditional in-person, do it in person, over Zoom these days, ways of science communication. There's the letter or email writing that you can do for science communication. And you can get in there with regular media or social media and do that as well. There's a little blur between regular media and social media these days, but these are three different platforms that I have been involved in to one degree or another, and you can too. Now, I want to talk about the issue of science consuming. So I'm not an expert in COVID. I'm an academic. I'm a professional engineer. I do science as a profession, as a career. And the way that I do science and engineering and that sort of thing is that I read what's out there, I process what I've read, I distill it into something that is meaningful and actionable, and then I share it. And that's what I'm doing in the classroom. That's what I'm doing with my own regular research, but it's also how I engage with science advocacy and science communication. I am consuming science and then I regurgitate it for either my class or for the general public. And you can too. Now let's talk about air quality. Air quality is important these days, specifically because of COVID. It is a hot topic these days because COVID is airborne. Air quality is also important in the long term in places like a public school or a university or college, because when we're trying to engage in learning, if the air quality is bad, the learning will not be optimal. Good air quality is good for good learning. But it's also good for general health. It's good for the general health of our staff. It's good for our general health inside and outside of the classroom. It's good in general at home, where we play, where we work, where we do our research. It's good for us in general. The problem is good air quality is expensive. And so it's important that we get talking about this to make sure that we improve air quality across the board. So let's talk about advocacy and choosing a topic of advocacy. You may have seen this diagram in the last year or so since the beginning of the pandemic. And what it talks about is well, effectively risk mitigation, that in order to mitigate against the transmission of COVID, we need multiple layers of protection, whether it's vaccines, whether it's respirators and masks, whether it's any one of these different layers. The more layers we place in the way of COVID, the more likely it is we are to block it. Well, it's also a really nice way of saying, hey, there are multiple topics in this domain, and if you want to get involved as an advocate of science, you can get involved at any one of these levels right here. So whether it's one of these like crowding or testing and tracing, filtration, which we're talking about today, you can get involved in any of these. And I've chosen some of these slices myself in terms of when and where and how I want to engage in advocacy. I've done a lot of this advocacy on social media. I've used Twitter for a lot of it. I've used Facebook a little bit of YouTube, a little bit of different platforms. In terms of Twitter, it's been really nice because it constrains you to a certain number of characters and ways of getting your message out there. And so I've practiced at keeping my messages short and tested certain things. And what I found is that if I put a message out there, whether it's because of timing or because of how I've said it, maybe sometimes it doesn't get any response at all. No likes, no retweets, no engagement. In other times, I've found that I'll get 300 likes or maybe 100 retweets, or I'll get a whole lot of different engagements. And when I look at the numbers there, I know that that particular message is resonating with people out there. And that helps me fine tune the way that I do my advocacy, the messages I put out there. I guess the next question is, well, does advocacy work? And let's give an example right here. Earlier this year, we were told by our politicians and by our leaderships that vaccine mandates were a no-go. We could not do a vaccine mandate. Well, except for one, the president of Seneca College. The president of Seneca College came out and said, yes, we can, in post-secondary institutions, have vaccine mandates. But that person was a voice, a sole voice in the wilderness. There was nobody else that agreed with the president of Seneca College. And it took grassroots advocacy, sustained for months at a time, to get vaccine mandates in place. And once they were in place, however imperfect these vaccine mandates are, we could move forward with further protections with respect to COVID. But it took advocacy from the ground up for it to actually happen. So yes, advocacy works. I'm going to give you some other examples right here. First one, modifying and sharing. A picture is worth 1,000 words. There's a paper out there that talked about the basis for the 2-meter distancing policies that we hear and see everywhere. And read through the paper, and there was a really interesting figure in it. This one right here, which basically said, if you have a certain number of variables in play, things are good. If you have the same variables but for different values in play, things will be bad. But there are a lot of variables in here. There's the issues of occupancy, ventilation, face coverings, type of activity that was engaged with. It's a complicated graph. And when I looked at this, I looked at it and I said, well, this is really interesting. And I showed it to my kids and I showed it to my partner, and they yawned and they said, James, we don't understand this. We don't care. And I thought, but there's really important information here. What could I do about this to make it more consumable? I added icons to it. I added icons to it to represent high occupancy, poor ventilation, respirators, masking, and activity type. I reinforced good versus bad in here because I wanted my kids, who are young, to be able to understand what this graph meant, even if they didn't want to read the words that were in it. And it got picked up on social media. It got picked up on social media, and it got picked up by a pair of architecture websites here in Canada. Little minor victory right here. It worked. It didn't get a lot of play, but it got out there. It was a success, however limited it was. Here's another example, one that a lot of us can get involved in. Maybe some of you have kids that take the school bus. Here, this is an issue of little conversations having big impacts. There's a paper out there that talks about computational fluid dynamics and the flow of air inside of school buses, flowing through the air, okay, inside, between seats, in and out of windows. And the question was, what do you have to do with respect to the windows on the school bus to make the risk of COVID less? Computational fluid dynamics for mechanical engineers in the audience, no, they're complicated. They're hard to understand. But a post on social media distilled it, okay? And basically the message was, you got to open the windows on the school bus. And I looked outside and I saw the buses were moving past my house on their way to school, and the windows were closed. And at the time my kids weren't taking the school bus, but eventually they did. And bus rolls up, and my kids get on the bus, and I take a look at the bus driver, and I take a look at the windows on my kids' school bus, and they're all closed. It's November, and I asked the bus driver, why aren't the windows open? And the bus driver said, because it's cold outside. And I said, but it's COVID. They should be open. You have a policy that says that they should be open. And the bus company does have a policy. And he said, well, I'll think about opening the windows. I then phoned afterwards. I had a polite conversation with the bus driver. And it's important to have those polite conversations. I then phoned the bus company and I said, hey, it'd be nice, good, to have those windows open because it'll help keep the bus driver safe and it'll help keep the kids safe. Let's make sure those windows are open on bus route so-and-so. Next day, the bus rolls up and the windows are open. And the windows have been open ever since that day. It's important to have these conversations. It's important that you have that conversation with the bus driver for your kids as well. And you will have success. Keep it short, keep it meaningful, keep it informed, keep it polite and respectful, and you'll see that change happens. Here's the next one, checking your HEPA. A number of school boards have introduced HEPA air filters into the classrooms to augment existing or non-existing HVAC systems, the ventilation systems, the mechanical ventilation systems in the classroom. I engaged with my school board to ask them about the HEPA units that they were already putting into the classrooms and more that they were planning to put in there, to find out if those HEPA filters were A, the right ones, and second, sufficient for the classrooms. We had that communication, and that was important because it's important that they know that parents are interested and involved in the process of choosing the risk mitigation tools in the classroom. They installed them. I went and had a look, and it turns out they're not being used right. They're in the classroom, but they're not being used right. What do I mean? Well, take a look at this. We have the HEPA unit in the back right here. There it is again right there. It is blocked on one side by a chair. It's blocked on the other side by a garbage can and recycling bin, by a counter on the other side, and in back by a wall. It is not 50 centimeters from the wall. It's not 10 centimeters from side objects. And in this case right here, it's a little hard to see. The exit port on the HEPA air purifier is blocked by papers. Okay, this is not being used correctly. I've approached our school committee. I've shown them the pictures. I've talked to them about it. I've approached the principal who is in charge of ventilation by law in Ontario, because this needs to change. What also needs to change is the fact that teachers and staff have received no training. Not in the TDSB, not in the French Public School Board. They have received no training on how to use these HEPA air filters. They need to be trained. The school boards are, in a lot of ways, exaggerating their metrics of convenience. Okay, the metrics used to put these into place in the classrooms. They need to put more of them in the classrooms, and they need to see the numbers that that is the case. We have not measured air quality in our classrooms, and there has been little to no verification of the use of these HEPA air filters in the classroom either. We need to send in engineers into our public school classrooms to verify the air quality and to make sure that the HEPA units are being used correctly and that our HVAC systems are up to par. Next up, speaking of air filters, how about do-it-yourself air filters? Making change with do-it-yourself air filtering. This has come about because air filters are expensive. These air purifiers, these HEPA units, cost anywhere between $800 and $1,000 and $1,500 a pop. They're expensive, and school boards don't have a lot of money. Now, the HEPA units are being placed in the classroom because there's been a shift in thinking based on what's going on in the medical community, but as well in the engineering community. We're hearing from the medical community that their initial assumptions, their statements that kids couldn't transmit COVID are incorrect, and we're hearing from the engineering community that air quality is important and that we need to do something about it as well. And here are the things that we can do about it. And one of the things to address the cost issue with getting HEPA filters or air purifiers into the classroom is building them from scratch, or building them using off-the-shelf parts, in fact. And what we see here is something called the Corsi-Rosenthal box, something that has been examined and quantified and tested by engineers out there, including labs in the United States. And what it is taking off-the-shelf, high-end furnace filters, like 3M furnace filters, putting them in a cube shape and adding a box fan to the top. And by doing this, you draw in dirty air through the sides, and then you blow through the top clean air into the classroom. These cost somewhere in the neighborhood of $100 to $150, about 1/5 to 1/10 of the price of a commercial unit. This is affordable for a lot of schools. It is a way to engage with air purification in the classroom. And what I'm seeing is that this is resonating, especially in the United States these days, with a larger than, for my videos at least, a larger than usual contingent of women, and it tends to skew a little bit higher. So we're starting to see a lot of resonance with things like this to get these into our classrooms and into our workspaces. Here's the next example, the final example, mask policy changes. Working from the inside. Sometimes we have to make change from within our organizations. This time I'm going to talk about masking. Masking in a lot of institutions, in a lot of workplaces, has been an anything goes kind of thing. And when that happens, we get people coming into the workplace, coming into our schools, coming into our post-secondary institutions wearing cloth masks or nothing at all. And when that happens, okay, and this is from a publication that comes out of the United States by Dr. Brosseau. When that happens, if one person is infected and in the same room as somebody who's uninfected, and both are wearing nothing, no cloth masks, nothing, it's about 15 minutes to an infectious dose of COVID. If those people are wearing, if both are wearing cloth masks, it's only 26 minutes. So if you're in the grocery store and both of you are wearing cloth masks and one of you has COVID, you don't have long before it's possible that you have an infectious dose of COVID. Now, if you go up to N95s, non-fitted, so you don't have to go to a professional fitting agency or office to get fitted properly for your mask. You're still just wearing an N95 mask. So an N95 mask, it's 6 hours. 6 hours before an infectious dose. Now think about that in terms of a classroom, where you're in the classroom for an hour or two with somebody who might be infected. If both of you have the mask, it is far less likely that N95 mask that you, if you're uninfected, will become infected. That's important. Now let's take a look at the current masking policies here at a place like York University. If you take a look at the masking documentation, there is an emphasis on things like the cloth mask and face coverings documentation from the City of Toronto. We shouldn't be wearing cloth masks on campus. We should be wearing N95s. The question becomes that 2 years into the pandemic, why are we still allowing and referring to cloth masks as being okay? It isn't okay. The anything goes approach is wrong. We should no longer be doing it, and the science tells us so. Our mask policy needs to change simply based on that. But there are other things that indicate we need a change to our masking policies. The issue of not being able to verify somebody's masking exemptions or masks themselves is now incorrect, and the Ontario Human Rights Code or Commission has said so. They've come out and said so in black and white. Verification is okay, and our mask policy should reflect that. The other issue is that there are inconsistencies in a lot of people's masking policies, a lot of institutional masking policies. One of them is that in some documentation, the most recent ones, we have been told that 0 meters distancing is permissible. But in others, including the masking documentation, it relies on 2 meters. 0 meters, 2 meters, that's contradictory. It is not good policy to have contradictory information. We need to update it. How? Using the science. I have brought these questions up. I've percolated them up, starting with my department, going all the way up through the dean's office, and further up to our COVID advisor on campus. It made it all the way up to our provost. And what did the provost say? The provost said, go to the website with the contradictory information. The provost said, we are abiding by public health guidelines. Well, it turns out that we have been told by the Ministry of Colleges and Universities that we don't need to simply abide by public health guidelines. We can go above and beyond public health guidelines. The question becomes, why aren't we? We should be. The science tells us we should. And to that end, I have done things like going to my department and saying to my colleagues, can we bring N95s into our school? Should we bring in CO2 sensors to verify air quality? And should we and can we bring in localized HEPA filters into our classrooms and workspaces? And my department colleagues said yes, to the tune of 3/4 in a vote at the most recent department meeting. That is a win right there. We're now bringing it up to the faculty level. That's coming up soon. And I'm hoping that it percolates all the way up, back to the provost and the president and the senate of this university, so that we can make real change for everyone on campus. So I've given you 6 examples of grassroots advocacy and varying degrees of success with respect to them in something as important as COVID. In conclusion, science communication is important. It's hard. However, if you do the right things, if you follow good practice, like timing, you can have success in your science advocacy, and we can achieve both short and long-term changes. You don't have to do everything. You can pick a slice in science advocacy and choose that to be good at and to advocate for. It can be the conversation you have with your school bus driver. That can be it. That's a win if you can get change right there. You need to understand your audience. Speak to your audience the way that they're expecting to be spoken to. Communicate with them the right way. And understand that sometimes you're going to win some, sometimes you're going to lose some. But the idea is to do basically a whole shift in the public's thinking, to get generally a win across the board. Okay? There you go. Science advocacy in times of pandemics. Thank you.